Hi, and welcome back to Hey Doc, What's Up? We're going to do a little bit more discussion about autoimmune thyroid disease because it is A, so common, and B, so misunderstood. So it deserves a little bit more time to really delve into what you as a patient may be told or not told about how your thyroid tests are coming back. So remember, the thyroid globulin antibody is attacking your thyroid gland. That's that enlarged thyroid that may look lumpy or feel lumpy, or you may see two things moving up and down your Adam's apple and another lump. Remember that your thyroid peroxidase antibody is attacking that free T3. That's the muscle protein, the joint protein that goes out and gives you energy. That's your free T3. So what do you do when you get positive numbers on these antibodies? Well, what many doctors will actually tell you is, well, once it's positive, it's always positive. There's nothing we can do about it. Wrong. If you know it's from inflammation, number one, and if you know that inflammation can be resolved if you go after the source of the inflammation, then you can actually impact antibody levels and bring your antibody levels down to the point where you now go into remission, meaning that your immune system may be sensitized if it sees it again, but if it doesn't see it, then it's like the beat cop walking past the storefront and the storefront got fixed. It looks normal, so it's going to keep on going. That's what remission with autoimmune disease means. Doesn't mean you can never have gluten ever again in your life, but it means if you do, you take that risk, especially if you do it more than once or you do it regularly, of resensitizing your immune system. So what do I mean about you've got antibody levels and then go into remission? Well, I'll give you an example of a patient that when they first came in, not only did she have the autoimmune issue of vitiligo, white itchy patches on her skin all over her body, that would even wake her up in the middle of the night. But she also had autoimmune thyroid disease in that these antibodies were both positive and they can be quantitated. They can be given a number of how much your immune system is attacking, okay? So it is normally that there's a range for what we don't want those antibodies to be over. So you can have a little bit of antibody there, but it's not enough to really cause a problem. But if you have a normal range, for instance, for thyroid peroxidase antibody of less than 34, and the number comes back greater than 6,000, that's a problem. Your immune system is going crazy, and it is attacking your muscles and your joints. So what if your thyroid globulin antibody, which is normally less than 1, comes back again, and this particular patient, hers was also greater than 6,000? That meant she was attacking her thyroid, and she actually may have not only nodules and an enlarged thyroid, but now she's at risk that if you attack a thyroid gland hard enough and often enough, it may actually cause thyroid cancer. That can be picked up by an ultrasound looking at one of those lumps on a thyroid or nodules that has a fuzzy border, meaning that whatever was on the inside and growing at a faster pace than the thyroid tissue broke through. Anything that breaks through a normal boundary is usually not a good thing in medicine, okay? That usually means you better biopsy that and find out. So when you see that fuzzy bordered nodule, it means biopsy, okay? And we've averted thyroid cancer in many a patient by finding that fuzzy border. But in particular, once you're positive, does that mean you never check again because once it's positive, it's always positive? Wrong. I have taken people from levels of greater than 6,000 on both, and by watching gluten, watching other sources of their immune system getting hypersensitized, that we have taken down their antibody levels and put them in near remission in some cases, in remission in other cases. So it's a question of how diligent you want to be about dropping your antibody levels. No, it doesn't happen overnight, but what if you can get rid of not only painful joints, painful muscles, and you can actually drop your antibody level, drop inflammation in your body? It's all under your control. You simply need to know the right information in order to impact that. So once positive is not always positive. And if your doctor says it is, then you might need to find a new doctor. So next time on Hey Doc, What's Up, we'll delve even a little bit further.